There used to be a mystical aspect of medicine, and now I feel like it's just a skill set. Like, I purely view it as a skill set that you learn. There's a lot of factors from this, right? Doctors used to be very highly regarded back in the day, and now no one gives a F what doctors think anymore. Doctors are laughed at in society. It's just like another job. It doesn't really help you in terms of societal respect, I've found. It doesn't really help in terms of relationships, dating. It doesn't really help in terms of job satisfaction. Like, most doctors I see are burnt out. They don't like what they're doing, all of this stuff. And I think they sold us a lie. If you think about 100 years ago in medicine, it used to be something that was very respected. It used to be that, oh yeah, you were on the echelons of society. You put in that hard work, and so you get that respect. And so nowadays, it's literally just a job path. And I've experienced like admin stepping over my toes. You've probably experienced admin telling you that, okay, do things this way, don't do things that way, do your documentation just like this. Like, I remember being in the hospital, and when I was in the psych ward, we had a new medical director, and the medical director was very specific on the types of documentation that he wanted. And because he was specific on that, it's like we had to add in all these extra efforts to a note to satisfy some admin god that this thing was done and this thing was done, so that way we can maximize billing. I remember when I worked in the psychiatric ER in my child adolescent fellowship, the mental status exam, instead of just being able to say that, oh yeah, like you do the patient present like a narrative one, you had to put in all of these checkboxes that you click individually, all the different checkboxes. And the note had so much crap in it that it took just as much time to see the patient as it did to fill out the note. So literally you would budget double the time for the patient. I remember thinking that, okay, why can't we just have a scribe? Because the doctor's time is worth way more. So if we had a scribe at least doing this, then we'd be able to work toward the top of our license. And they were just like, oh yeah, money. We'd rather work the doctor more. And then I remember thinking this in residency as well. Hold on, why don't we have scribes? Because if we had scribes, this was before AI. If we had scribes, then the doctor would save so much time documenting, and we could actually use our expertise to help out another patient. But it was just like, nope. So all of these things, right? Like, doctors, we are just gears in the system. Our goal is we want to care for patients, but the doctors just want us to generate revenue. That's it.